Hypersomnia. Part 1. What is hypersomnia? Hypersomnia, or excessive tiredness during the day, is also called excessive daytime sleepiness, or EDS. These are unprovoked sleep attacks. Hypersomnia shouldn't be confused with fatigue, which is being tired. Those with hypersomnia can fall asleep at any time, including while they are driving or working. According to the National Sleep Foundation, up to 40% of people have some symptoms of hypersomnia from time to time. The study of hypersomnia is in its infancy compared to other medical disorders. Part 2. These are the disorders that we will be reviewing: narcolepsy type 1 and type 2, Klein-Levin syndrome, idiopathic hypersomnia, and insufficient sleep syndrome. Part 3. Narcolepsy. Narcolepsy is characterized by the classic tetrad of excessive daytime sleepiness, or EDS, cataplexy, hypnagogic hallucinations, and sleep paralysis. Narcolepsy is thought to result from genetic predisposition, abnormal neurotransmitter functioning and sensitivity, and abnormal immune modulation. Symptoms of narcolepsy can include cataplexy, or the weakness of extremities during extreme emotions. A lot of people who have narcolepsy may have extreme excessive laughter or some type of emotion causing their extremities to become weak. Excessive daytime sleepiness, sleep hallucination, sleep paralysis, automatic behaviors, and then disrupted nighttime sleep. Primary treatment is medication. Secondary treatments for narcolepsy can include any of the following: exercise or movement. Nutrition is very important. Planned naps, so times that they know that they have to rest. A strong sleep and morning routine is essential, and also social support from people who are going through the same thing. Part 4. Klein-Levin syndrome. Klein-Levin syndrome, or KLS, is a rare disorder that starts during adolescence and has a male gender preference up to 68%. The patients have recurrent episodes of hypersomnia, which are often associated with compulsive overeating and hypersexuality. The periods of hypersomnia occur for days to weeks at a time and recur several times a year. In between the symptomatic periods, the patients have normal sleep requirements and do not have excessive daytime sleepiness. Some patients may develop symptoms of irritability, impulsive behavior, depersonalization, hallucinations, depression, and confusion. The etiology of this disorder is not known, but genetic factors are believed to contribute. The median age of onset is 15 years old, and the syndrome may last up to 8 years. The episodes recur every 3 to 4 months and may last up to 10 days, but they may last longer in women. Klein-Levin syndrome may be precipitated by infections, alcohol consumption, sleep deprivation, unusual stress, physical exertion, traveling, head trauma, and marijuana use. Symptoms of infection-triggered Klein-Levin syndrome generally occur shortly after onset of fever, about 3 to 5 days. Klein-Levin syndrome is very rare. However, there are people that have menstrual-related symptoms similar to this disorder. This includes bouts of sleepiness and can last a few days to a few weeks. Other more rare symptoms include excessive eating and unusual cravings, and irritability, aggressiveness, and childlike behavior. Klein-Levin syndrome usually starts in the early teens, and there is no specific treatment. However, nutrition and exercise can be beneficial. Part 5. Idiopathic hypersomnia. Idiopathic hypersomnia is a neurological sleep disorder that can affect many aspects of a person's life. Symptoms often begin between adolescence and young adulthood and develop over weeks to months. People with idiopathic hypersomnia have a hard time staying awake and alert during the day. Chronic excessive daytime sleepiness may be a problem. They may fall asleep unintentionally or at inappropriate times, interfering with their daily functioning. They may also have difficulty waking up from nighttime sleep or daytime naps. Sleeping longer at night does not appear to improve daytime sleepiness. Idiopathic hypersomnia is a chronic disorder. Symptoms may remain generally stable over time, or severity may fluctuate over time. The cause of idiopathic hypersomnia is not known. Some people with idiopathic hypersomnia have other family members with a sleep disorder such as idiopathic hypersomnia or narcolepsy. Currently, there are no treatments approved by the FDA specifically for idiopathic hypersomnia. Idiopathic hypersomnia can be with or without longer sleep times or needed to nap. It is excessive daytime sleepiness. People with idiopathic hypersomnia will feel refreshed after a nap, but that will only last a short period of time. A person with idiopathic hypersomnia may have sleep onset hallucination, sleep paralysis, or vivid dreams. Treatment recommendations for idiopathic hyperinsomnia may include medication, but it generally does not help, sleep hygiene, exercise and movement, and good nutrition are all three really great ways to help with idiopathic hypersomnia. Part 6. Insufficient sleep syndrome. Insufficient sleep syndrome occurs when you regularly fail to get enough sleep at night. The result is sleep deprivation. This keeps you from feeling alert and well rested during the day. It is a result of choices you make that keep you from getting enough sleep. It is voluntary but unintentional. You are normally unaware that you need more sleep than you are getting. An exam shows that you are able to sleep well when given the chance. It also detects no medical reason for you to be sleepy. A mental exam also reveals nothing abnormal. Someone with insufficient sleep syndrome may routinely spend less than 8 hours in bed at night, have a close friend or family member note that they need much more sleep than they get, have their symptoms improve if they sleep for a longer period of time, be free of any other medical or sleep disorders that might cause their symptoms of excessive sleepiness, have concentration and attention problems, lowered energy level, reduced alertness, distractibility, irritability, or fatigue. Insufficient sleep syndrome affects about 2% of people who go to sleep centers for help. It tends to begin in adults who are in their mid to late 30s. It often goes undetected until they reach their 40s. It affects a slightly greater number of men than women. It can be caused by day shift work schedule. This requires you to be at work at an early hour. Other time may then keep you from getting to bed early enough. This reduces your total sleep time. People with this disorder often ignore the obvious cause. Insufficient sleep syndrome. For a medical diagnosis, the symptoms must exist for at least 3 months. The amount of time needed for sleep depends on the individual. Most adults need 7 to 8 hours, and teens need 9 to 10 hours. Planning for enough sleep. Treatments for insufficient sleep syndrome include excellent sleep hygiene, change in daytime planning for enough sleep, nutrition, and proper exercise. You are ready for the next module.